semplicemente simply say something. I hope I have sabato. Domani andiamo a Tripoli. The blast is hopefully a one-off, devastating blow that has killed, maimed, and destroyed. But of course, the consequences can be addressed through humanitarian and reconstruction money and resources and interventions. But the blast is also the symptom of a broader crisis of the country, and we know that. That crisis is political, so has to be solved through political discussion. This is far beyond what my organization or my organization's mandate. But the blast also calls, shows that this country needs longer-term interventions to address rising poverty, to address functioning public services, to address security, and so forth. Now, all of this is a bigger package than the humanitarian package, and this package needs to be addressed by the international community. We have made this capacity available to the aid community to respond to the consequences of this blast. Not only for refugees, who of course are our main target here in the country, but also for Lebanese nationals that have been impacted. Without forgetting, of course, that this country has hosted refugees for more than 7 decades. The Palestinians, the Iraqis, now the Syrians. So I think it is important also on the part of the refugee organization to send a signal that the time has come to also show the Lebanese when they are in their hour of need that the international community responds, including through UNHCR. We are aware of a relatively small number of refugees that have tested positive, between 250 and 300. So it's a relatively small number if you think that refugees here are hundreds of thousands, so it's a small number. I'm talking about Lebanon. Worldwide also the figures are in the tens of thousands. There are 26 million refugees around the world and almost 80 million refugees and displaced, so the figures are small. This is in part due to relatively limited testing, and in some situations we've been able to prevent the spread, especially when refugees are very concentrated in Asia and in Africa. So in a way, the health impact on refugees of COVID has been very much the same as the local population in the countries where they find themselves. Where we are worried, and we're worried in Lebanon as well, is the economic impact. Because as we know, the lockdowns have created a lot of new poverty among the most vulnerable in society. And inevitably, everywhere, refugees, poor migrants, displaced people are among the poorer people in society, and very often the type of jobs that they do are the first one to disappear in a lockdown situation. So this is what worries us most at the moment in terms of pandemic impact on forced displacement.
Yes, we should sit and...
Sorry, it was going to say.